Before you test your sugar, here are 5 things that make a big difference. Hello friends, this is Dr. Munjal Shah. Do you think getting the right blood sugar report is all about giving the sample and getting a printed report? Well, as a doctor who has seen thousands of reports every year for more than a decade, let me tell you this. The patient's preparation for the sugar test ensures a good result of the report. Now, over the next few minutes, I shall share a few simple tips and tricks that can help you get the most out of your sugar report. Let's start with fasting sugar, one of the most popular and common tests ordered. Alright, so fasting means no food for at least 8 hours. It can be more than 8 hours, that's fine. Less than 8 hours is not correct. Alright, fasting means you can have only plain water. No chewing gum, not even the sugar-free ones, no nariyal pani, no juices, just plain water. Next point I would like to say about postprandial. Now, the word prandial means a meal. It could be post-breakfast, it could be post-lunch, right? So, when you talk about postprandial, whenever the doctor will write PP sugar or postprandial sugar, please ask the doctor whether this is about breakfast or lunch, post-breakfast or lunch or post-dinner. In general, a postprandial sugar is equal to post-lunch sugar. Usually, that is how we also write PLBS, right? So, if you have given a sample after your breakfast, please make sure that you write in your report that this is a post-breakfast meal. Now comes the surprise part. Can postprandial sugar be less than fasting sugar? Yes. In some cases, even in normal individuals, this can happen. And it's, you can say, kind of an anomaly also. Why does this happen? The main reason is here, this is because of a phenomenon called reactive hypoglycemia. That is, either your body for that meal has become little sensitive, more sensitive to the insulin, or your body has released more insulin, right? So it can also happen because some diabetics take medications after their meal, or in some cases because of some stress hormones in the morning, your fasting sugar has shot up a little bit. Similarly, don't change the timing of the medications on the day of your blood test. In short, a blood sugar test should not be affecting your daily routine with respect to your meals or your medications to be able to truly reflect your blood sugar levels. Active infection can affect your blood sugar. Now, this is a very underrated point. Let me explain. Active infection could be any seasonal flu, cold or cough, dental infection, or urinary tract infection, which are very commonly seen. What happens is, during this time, the body releases stress hormones, which leads to an increase in your blood sugar levels. Therefore, only get it tested only when your doctor has asked you to test for blood sugar during this time. I often get patients who tell me, मेरा fever का test हो रहा है, तो please do my sugar test also. That is what I'm trying to caution you about. Another common excuse I hear during the sugar testing is that some patients say that, oh, my sugar has come high because yesterday I indulged in a lot of sweets. Remember this, the doctor wants your everyday sugar, not your test day sugar. So, if you are having extra sweets or because of the test, you are having less amount of meal on the previous day, that is not the right way to test your sugar. Lastly, but often a very common query, patients often ask me, Doctor, my results from the lab are not matching with the home glucometer readings. To this, the answer is very simple. Remember, when you do your glucometer testing, what you are testing is blood from the fingertips. That is capillary blood. And when a laboratory tests, that time the blood is taken from your elbow, this part, which is the venous blood. Now, anatomically speaking, there is always about 5 to 15% difference as per studies in the blood sugar readings from capillary blood compared to the venous blood. Finally, here are some bonus tips to make your sugar test more meaningful. Avoid heavy exercise before the blood test. Avoid alcohol on the previous night, especially and preferably for the whole day previously. Also, a good night's sleep is very underrated. So have a good regular night's sleep before the day of the test. Now, one point which surprises everybody is how do you calculate the 2 hours for a postprandial or a post-lunch sugar test? The 2 hours have to be calculated from the start of the meal. It's very important to understand that start of the meal and end of the meal can have a 15 to 20 minute gap depending on how much time the person takes. Therefore, the counting has to be from the start of the meal to ensure standardization of your result, because you can't control how much time you will take for a meal. So guys, blood test doesn't just depend on the lab or the machines. It depends on you too. So the next time you go for a blood test, remember all these points. A little awareness can go a long way in getting the right diagnosis and the right treatment. Share this if you found it useful with someone who's getting the sugar test done very soon. Thank you.